A patient's guide to colposcopy. What to expect when having a colposcopy. You may have had a recent abnormal pap test and your physician has referred you to a clinic or specialist to have further evaluation and investigation. This video will go through the following. What is a colposcopy? Why do I need to do this? What to expect? And treatment and next steps. What is a colposcopy? A colposcopy is a type of test that allows your healthcare provider to get a close-up look at your cervix, the opening to your uterus. It is a quick and easy way to find cell changes in your cervix that may or may not turn into cancer. A colposcopy is a standard follow-up exam to any pap test that has shown some abnormal cells. It lets your doctor further diagnose any problems. Why do I need to do this? Cervical cancer symptoms are hard to notice, but this test can find abnormal cells before they become cancer. The success of colposcopy in preventing cancer relies upon both having the initial exam and then a follow-up exam to see if there are any differences. If precancer cells are identified, treatment can be arranged before the cells change further into cancer. What causes abnormal cells? Abnormal cells are almost always caused by an infection from the human papilloma virus, or HPV. There are over 200 different types of HPV virus, and very few actually cause cancer. Infection from HPV is very common. Virtually anyone who has had sexual activity or skin-to-skin contact can be exposed to this virus. Most HPV types do not cause cancer, but some do. There are other reasons for abnormal cells found during a pap test. They can be changes in the level of estrogen or reduction in the cells of the cervix. If you're pregnant in the months after delivery, when breastfeeding, or during or after menopause, often these cell changes are not cancerous. The tissues of the vagina and cervix contain estrogen. This hormone helps the cells stay plump and moist. When the body's supply of estrogen is lowered, sometimes the cells can look abnormal on a pap test. The colposcopy procedure will indicate whether the pap test only looks abnormal due to a lack of estrogen or because the pap test is abnormal. What to expect? Your appointment will be scheduled within a number of weeks after a referral is received. Come prepared for your appointment. Before the appointment, ensure that you bring your picture ID and your Alberta healthcare card. Plan to spend at least 1 hour for your appointment. Bring a pad or tampon with you. It is important that you do not miss any of your appointments. If you are unable to come, please telephone the clinic directly and make sure you get a new appointment date and time. Day of colposcopy exam. Confirm your contact information at check-in. We will spend some time explaining the procedure to you and to tell you our clinic routine regarding test results and follow-up. You will be asked to give the date of your last menstrual period, the number of pregnancies that you have had, and the type of birth control you are on. You might be asked if you are in menopause or whether you have had a hysterectomy. You will need to know if you have had the HPV vaccine and the year it was given, and whether you have had a colposcopy or treatment for abnormal pap test before. After your appointment is done, it is okay to return to your normal activities, even on the same day. During the colposcopy exam, when you are brought to the exam room for the procedure, you will need to undress from the waist down, and you will be given a gown or a sheet to wrap around your waist. Once the specialist or nurse has explained the procedure to you, you will be asked to lay down on the exam table. Your feet or legs may be placed into the stirrups for support. The colposcopy exam is very similar to a gynecology exam. Liquid solutions of vinegar or iodine are used to help identify changes in the skin and locate any areas which may have led to the abnormal pap test. Women who have had hysterectomies can also have precancerous changes to the skin in the vagina. How is a biopsy done? The doctor will look at the skin through a colposcope, similar to binoculars or a stand-up microscope. With a special forceps, the doctor will take tiny pinches of small pieces of tissue about the size of a grain of rice. These are sent to the lab for testing. You may feel a pinch, a scraping feeling, and you may feel some cramps. The doctor may apply a medicine to the area to stop any bleeding from the biopsy sites. You may have a bit of vaginal discharge, like the end of a period. It can be clear, bloody, black, or brown. All of this is to be expected, but it can stain your underwear. After the colposcopy exam. You may feel cramping after the exam. Use of a hot water bottle and Tylenol or Advil can help. Spotting can happen, and the use of a pad or tampon is recommended. It is okay to resume normal activity after the appointment. Following the colposcopy exam, the doctor will review the procedure and give you the proposed plan from the following options. You may be monitored by colposcopy, you may require treatment, or you may be discharged back to your family doctor. If biopsy samples were taken, it is necessary to wait for these lab tests to be ready, and then your doctor can confirm next steps. Sometimes the biopsy may be different than expected, so these results are necessary to make a diagnosis. Once the doctor has all of the information needed, which can take up to a few weeks, a final decision will be made by your colposcopist as to what to do next. You may receive a phone call from a member of the team if the results were different than expected. Treatment and next steps. If the changes were minor or normal, then the recommended follow-up is usually to do another colposcopy in 6 months or a year. If further treatment is required, the most common treatment method for changes to the cervix is to remove the abnormal tissue either through a LEEP or laser procedure. You will be contacted by telephone to schedule a treatment appointment. The clinic may ask you questions about your medical history and about any medications you are taking. Treatments might be scheduled either as an outpatient in the colposcopy clinic or in the hospital as a day surgery procedure. Remember, it is important that you do not keep having Pap tests done while you are being seen in the colposcopy clinic. Even if your doctor suggests it, remind them you are being seen in colposcopy. Please contact the clinic if you become pregnant, your plans change. Do not cancel your appointment. Always reschedule if you are unable to make it. Or if you move away, we can transfer your medical records to your new doctor. If you have any questions or concerns, please contact your colposcopy clinic. Thank you for taking the time to view this video. Please discuss any questions or concerns with your healthcare provider. Thank you.